All right. Well, today we are talking with Dr. Erin Holder. And Erin, go ahead and just tell me a little bit about how you got into holistic veterinary medicine.
Well, first of all, thanks for having me here. It's nothing I like better than to talk about holistic medicine, which is a passion of mine. I was late to the game in veterinary medicine in general. Most of my colleagues wanted to be vets since they were little, but I went to school to be an engineer. And in the middle of that education, realized that was not for me. I wanted to pursue more of a hands-on environment and found veterinary medicine and went into University of Florida and loved every single minute of it, except for the part where your clients would come in and give you their bucket of medications that they were on, and this medication was causing these symptoms, and this medication was prescribed for those symptoms of the first medication, and really began to look back to my roots. And I was raised with whole foods and vitamins and drink lots of water with lemon. And, even at that time when I was raised that way, it wasn't the most common thing. So started to look back at my roots and just kind of question, like, why are we doing this? Are we really making our patients better? And over the course of that school, and meeting our amazing acupuncturist on the University of Florida staff, realized that there was definitely a better way to practice medicine, and knew even before I graduated that I was going to embrace holistic medicine, and pretty much every facet that I felt great about would pursue that. And that's exactly what I did. So over the course of 2 decades, became certified in veterinary acupuncture, certified in veterinary Chinese herbal medicine, and Tui-Na, which is a hands-on massage therapy, and then furthered studies with energy medicine and Reiki and hands-on healing, and then now am enrolled in homeopathy school. So the learning always continues, but the realization that our goal of Western medicine to suppress the symptoms, and learning in homeopathy that as we suppress those symptoms, other things are going to arise in the body in different places, and we're not really treating these patients. We're not bringing them back to health. Symptom suppression is not the return to health. It's simply symptom suppression.
Yeah, exactly. You couldn't have described that better. So, when you started your initial veterinary practice, how did you determine how you were going to integrate your holistic modalities with traditional veterinary care?
I started my veterinary hospital to be an integrative hospital, period. This is what we do. We are not a Western practice only. We are using and appreciating Western medicine where it belongs, which is in diagnostic and acute medicine. Just my very humble and personal beliefs. But looking elsewhere, outside of the box for chronic. And I believe that at the time that I opened the hospital, we were ripe for this because we got a massive influx of people, with minimal advertising, because there's this movement now. The world is ready for it. We understand that there is most definitely a better way to bring healing about, and trusting that our bodies have that innate ability, when directed in the right way and given the foundational support that's needed, to move in the right direction of healing.
Yeah, definitely. So I wanted to ask you a little bit about ozone therapy. Some of our viewers may have heard of it, some may not have, but I know it's something that you are currently actively teaching. Tell us a little bit about what it is and how you can utilize this on animals.
I will tell you first how I found out about ozone therapy. As I was in my quest to learn everything possible for healing, I got the phone call that nobody wants to get ever, and that my nephew was suffering from metastatic cancer, and he was just 20 years old. And that really pushed me even forward, even harder, on a drive to learn everything I could, and was introduced to ozone therapy for humans and started reading all the scientific research behind it. Unfortunately, not that comes out of the United States, but mostly that comes out of international papers. Cuba, Spain, these are our leaders in ozone therapy research. And this is where ozone therapy is commonplace.
Mm.
And So the happy ending is that my nephew is doing fabulous. He's 10 years cancer free, and thriving. Um, Not but and what I got to learn from that in our 2 years of not sleeping and researching is how powerful ozone therapy is and how it can be used, in most every single case that we see. So, ozone therapy is when medical grade oxygen is electrified with a certain number of joules of energy, and that O2 molecule splits, and the O free radicals will recombine and reconfigure in ozone, which is O3. And it's a really unstable molecule. It doesn't want to stay present in the environment very long. So it wants to destabilize quickly back to oxygen and a free radical. So when you combine this with blood of the patient, or you inject it rectally or subcutaneously or use it in fluids, what you're doing is you're supplying a nice oxygen to the body, and then that free radical, which is actually really a non-radical, but that's a biochemical conversation for another day, um, stimulates, it binds to lipids in the body, lipids in the blood or lipids in the rectal mucosa, and it stimulates this cascade of healing. And it's far too many chemical reactions to talk about when we presented, just in Reno a couple weeks ago. It's an hour lecture, and that's just touching the surface of what it can do. But when you start to step back for a minute and look at ozone therapy, you see there's nothing on in the medical field, perhaps besides homeopathy, that can touch and do so many things at once, create so many cascade reactions of increasing oxygenation, decreasing inflammation in the body, stimulating the immune system to move in the right direction, because our immune system is not an intelligent being. Our immune system is just going the way it thinks it's supposed to go. And sometimes it needs a little nudge. If we're eating chemical food, chemical water, breathing chemical air, our immune system gets confused and becomes hyperactive, or it becomes deficient over time. Most of our immune systems become deficient. And this is when the big C arises. So C is in chronic disease, or C is in cancer, which is the end game, of chronic disease. So ozone is singularly one of the most powerful things you can do, and the administration of it is fairly simple. You can use it topically. We use it in dentistry. When I was in practice, we used it in dentistry, which was wonderful. We inject it back into the body after it's mixed with blood. Or we can have owners even do it at home using rectal administration, and being able to keep that ozone administration going over and over is so critical, to be able to keep the immune system on the right path, so that once again, we're not relying on drug therapy, but we are in fact relying on our innate ability to heal.
Yeah, so when you say owners can do it at home, are they purchasing an ozone machine then, since it's unstable and
Yeah.
sensitive?
So, yep. So you're going to purchase an ozone machine, and you're going to get trained on it, because there's certain things you have to know, like you have to use medical grade oxygen. Any other type of air could produce noxious gases that would be toxic. So you have to get trained on it. You have to get the right equipment, and we partner with O3 Vets, and they do a great job of helping owners get started with at-home ozone care. And then it's a matter of, will your pet allow you to do this, right? There's some cats who may tolerate, but most cats are not going to tolerate a rectal catheter on a regular basis. But most dogs actually tolerate it great and don't have any problem with it. And you can really, really change the course of some of your chronic diseases using this therapy.
Yeah, it's very cool. So I have one. I don't know if Serena told you that she convinced me to purchase one. So I can use it a little
Nice.
bit now. Yeah, so it's been fun playing with it for myself and the animals. But yeah, it's definitely, I could see how it would be beneficial for, you know, animal owners to have it and not just have to go into a vet practice to get that done.
Yeah, sometimes that's stressful. And we think of aging, and when we talk about aging, I think the scientific community has really come together in understanding that the aging is really the death of mitochondria.
Mhm.
And the death of mitochondria occurs, and mitochondria, for those you don't know, is just like the little engines in our cells. And when these mitochondria start to die off, we're essentially aging. And they die off because of a lot of reasons, but mostly because we lack the oxygen saturation levels in our body that we should have. So our vessels are starting to get hardening. they're not, our little capillaries aren't able to get the oxygen that we need. Our tissues start to suffer from lack of oxygen, and inflammation, and free radical formation that is not helpful for the body, that is actually damaging. And so the cool thing about ozone is that it literally can tackle all of these things. It increases oxygenation. It creates an ability for the red blood cell, which carries the oxygen, to release the oxygen in distal tissues. It also vasodilates. So we're opening up the vessels. We're creating an ability for the oxygen to be released from the cells. Now we're oxygenating our distal tissues. It decreases inflammation, and again, creates that cascade of events where it stimulates the immune system. So what a powerful anti-aging tool, right? Because anti-aging is, everybody's on the quest to be younger.
Yep, seems that way. Yeah, so if we have practitioners watching and they want to learn how to incorporate ozone therapy into their practice, I know you said you just gave a talk in Reno, but you guys have an online course too, right? Do you want to tell them
We
where
do.
they could find that?
Yeah. So animalozoneTherapies.com is the link to our online course for certification. And it'll take you about, if you sat down, maybe 8 to 10 hours and did it straight. But the whole point of this course is to teach you about ozone, because ozone, if used incorrectly, can be dangerous, and is to help you understand how important dosing is, and to give a foundation to the practitioners of how to be able to use ozone. So it lays out for you something that Dr. Barbara and I have worked very hard on, which is creating protocols. And we get those protocols from taking literature that is published from the human medicine journals, and just basically titrating down the doses to be effective for animals. So it's a work in progress. And there's not a lot of published information on these protocols for animals, but it is empirical data. And we have used this data for heading up to 10 years now with enormous success. When
Yeah,
used properly, ozone, yeah.
I know you've been
When
using
used,
it in the practice, so
yeah,
it's really effective.
for years and years. And when ozone's used appropriately, it's extraordinarily safe. There's just not a lot, if you use it with our protocols, not a lot that can go wrong with it. And, we do ask that within, these protocols, that you can do some variation and share with us your ideas, or what happens when you change the protocol. Like I said, it's a work in progress, but we have to be mindful that the FDA has an enormous negative view of ozone, and people in general hear ozone and it's a negative connotation because of the environment. And so that would be when electricity hits air and creates a noxious gas and ozone. This is not the same thing as medical grade ozone. And,
So I know a lot of people have ozone machines if they're cleaning out like a moldy building or something like that, and they know that it's toxic
exactly,
and you can't have animals in there. So then they're like, why would I want to put this toxic stuff in me?
exactly. That's exactly right. So medical grade ozone is not equivalent to using ozone to clean the air out. And you have to make sure that you, once again, get the right equipment and are trained. The FDA condemns ozone in the United States of America because historically, when ozone was used, it was used inappropriately and at doses because these physicians were learning, and this was international. And so there were some deaths associated with it. And so it has a negative connotation for sure, and the FDA condemns it. So it's important that anybody who is learning about ozone actually goes to the published research. And there are hundreds of articles, hundreds of published data on how ozone can help the body, humans and animals.
Yeah, no, it's pretty interesting stuff. I know just from personal use, and also family members, as you mentioned, your nephew with cancer. My aunt also had stage 4 lung cancer, and they utilized ozone as part of her treatment, and it was very effective. So it's pretty cool stuff. Um, so yeah, so if somebody wants to purchase an ozone machine, if they're interested in doing this, do you have one that you recommend? If they go to your website, can they find links or?
Yeah, you can go to our website and you can find a link to O3 Vets. And I would say just go straight to O3 Vets and just call Jonathan and just ask for help, and he'll direct you in the right way. We get zero kickbacks from this. This is just simply a partnership because we believe in the ozone machines. But the at-home hummingbird is just very simple to use. And then if you're a practitioner and you're doing higher volume, then you can go up from there and you can learn all that from Jonathan.
Yeah, I ended up getting the portable one from him. So
The Monarch.
bring it down to the barn. Yeah, the Monarch. Yeah.
Yeah, that's it. I have that one.
All those things. But yeah, it's definitely easy to
That's
use
nice.
and easy to move around. So yeah, very cool.
Yeah.
So the other thing I wanted to bring up is I know you have a wellness retreat coming up in April of 2025. I'm going to be attending it. I'm looking forward to it.
Yay!
Yeah, so tell our viewers exactly what it's about and why they might want to join us there.
My passion project of late. I really struggled in owning a practice that blossomed from a one doctor practice into a seven doctor practice with about 50 employees. And I struggled with a lot of aspects of it. I struggled with being the HR person, not really wanting to. I struggled with hiring an office manager. I struggle with the finances of it. I struggle with every single aspect of it. And at the end of the day, in 2022, decided to walk away from it. So I sold the business and walked away from it. And in so doing, looking back, realized that I was suffering from compassion fatigue and burnout. And I genuinely couldn't go on and move forward. And every veterinarian I talked to along the way is suffering from some form of this. I shouldn't say every, almost every, like it's an enormous percentage of us. And also, our veterinary staff turnover is just massive because of the burnout in the profession. We also struggle with culture, poor culture in the veterinary clinic. So, over the past few years after selling the business, I've just reflected on what could I have done better? How could I have avoided burnout? How could I have stayed in the game? And what came from that was something I'm deeply proud of. So maybe I wasn't supposed to stay in the game because I've created a project called Veterinary Compassion Project. And it is a very big scope of encompassing and learning to have the same compassion that we have for our animals. And veterinarians and veterinary staff members are the most compassionate people I've ever known. And it's learning to turn that compassion onto ourselves, as we also are some of the hardest judges of ourselves. And so, first, it's learning what compassion fatigue and burnout really is, which I studied all the books that I could read, everything I could find, and then there was very little resources on what you can actually do. The resources were dance, yoga, meditation, do all these things, but when you're talking to a group of veterinarians who are so driven and so willing to put themselves last, simply throwing out these solutions is not good enough. And the other aspect is that it's a very traumatic career. And I don't think people know that going in. And I think that once we're in it, we become not numb or hardened to it, but we just keep getting re-traumatized. And all of us come to our fields in our adult life with history of trauma, perhaps we haven't dealt with. So there's a huge facet of what this program encompasses. And so it is an education program of how we are suffering, and then many, many different tools presented to the veterinarians and veterinary staff members of how they can find their own healing journey. So it's not one healing path that you need to take. I don't have all the answers, certainly, but I can give you many different ideas of what may resonate. And an in-person retreat is so powerful because it's coming together. It's saying, let's talk about this. You're not alone. We're all suffering, whether we're at work smiling, there is a great number of us that are suffering from burnout, compassion fatigue. And so with this project, I've gotten a lot of people reaching back out to me, and they are just able to say, hey, I need help. And that to me is really amazing. So I'm super, super excited about this. It's going to be April 4th through 6th in Petaluma, Northern California. And we're going to have amazing, the event is going to be spectacular. We have some filmmakers coming to show us the film Rescued Hearts. And we have They're going to be filming the event, and we're going to be having some wonderful guest speakers, and we're going to have camaraderie and education on compassion, fatigue, and burnout.
Awesome. Yeah, I know I'm really
So
looking forward to it. So yeah,
thank you.
it's going to be a good time. And yeah, so anybody that's listening, they should definitely check out the website and looking into this event. I'm assuming you're probably going to hold other ones after this as well.
My goal is to do annual. So we'll see what the interest is if we go more than annual, but I'm thinking we'll do annual. And it's something to come back to. Like, we need to be reminded of these tools constantly, because we go back, we're so excited to go back and take these tools into life, and then we go back and we're living our life and we're busy and we're taking care of our kids and we're making dinner and we're taking care of our spouses, and then we forget. And so to be able to come back to this place to relearn, to recharge, to re-energize, and to create this community out there that, we haven't decided quite yet what it looks like, but this community should be able to get in touch with each other. We should be able to say, hey, I'm having a bad day and I just need somebody to listen. I don't need you to fix my problems. I just need you to hear. And you can certainly hear me because you do this every day. This isn't talking to a spouse who doesn't know what we go through. We have a very special profession.
Yeah, that's a good point. So will you hold the future ones in California as well, or do you plan on doing other locations?
I don't know. I don't know. I'm really focused on getting this one done, getting the feedback from it, and creating new opportunities. I think that one of the most exciting parts about this retreat is just all the partners that we're having, all the people that are coming out of the woodwork to help with to help veterinarians and veterinary staff members. And I just make a phone call to some great people in the Heart Math program, and instantly they're like, how can we help? Horses for Mental Health just came to the farm to film, and they're going to be releasing a documentary on the plight of veterinarians. Zoetis is involved in mental health. Like, all these people are now coming together to join in, because it's undeniable now. We are seriously in trouble. We're coming to a great 15,000 veterinary shortage in the year 2035. Like, we're in a serious crisis here.
Especially for equine and farm vets. That's in this area.
Absolutely.
It's almost impossible to find new ones. The old ones are retiring, and it's hard to find new ones. So yeah.
It is. Yeah. Yeah. Everybody who's like, oh, you just moved here. Oh my gosh, do you practice? Are you going to practice here? Like, what are you going to do? We need veterinarians. Like, it's everywhere. And it's really, and finding good veterinary technicians who can live off the salary, who want to stay because the culture is wonderful in the veterinary hospital. It's loving and compassionate.
Mm-hmm. Yeah, definitely. Well, tell us a little bit. So you have some exciting stuff. You're starting your own little farm. So what's happening there?
I am. So I can't think of why I never did this sooner. It is genuinely filling my soul and heart. I've found a different purpose, and that is to have my horses. I have two and a half. I have two halflingers and a pony, and just got two St. Croix sheep. So I've got them. Learning how to take care of them has been so much fun. I never had any experience farm animals. Small animal and exotic veterinarian, and we are just having the best time. So we're looking into potentially planting lavender, to have a lavender garden, and maybe
That'll be
doing
nice.
yes, maybe bringing on some Wensleydale sheep, which are really cool. They're from England. So we've been doing lots of tossing around ideas of what we want to do on this farm, and it has been an extremely healing place for me. And I think probably in the year 2026 will be re-entrance into working as a veterinarian and building a new practice again for me. So I'm not out of the game forever. I just needed a little break.
Understandable, but yeah, that's cool. So you have a lot of exciting stuff happening.
Oh,
Anything
yeah.
else you feel like you want to share with our followers, anyone that's viewing this?
So if you'd like more information about the retreat, visit my webpage that is named now Veterinary Compassion Fatigue Project.com, long name. But we're going through a rebranding process, because as I was naming this, I felt like it was more of a negative connotation, and what I really want is a positive. This is a positive place of camaraderie and healing. And this is now named Veterinary Compassion Project. And we are about to release our new website. We've started a podcast. I write blogs. You can find all this on the website, veterinarycompassionfatigueproject.com. And it'll reroute you to our new website once it's up and running. So I think that's the most important thing is please don't be shy. Please come and jump on and let's get together and help.
Yeah, awesome. So this would be open to vet techs as well, not just veterinarians and
Absolutely. And even
residents.
animal rescuers. Yeah. Yeah. So anybody working in the animal care field, it's exhausting, period. There's no two ways around it. So this is made for you.
Awesome. Well, yeah, I hope that we'll get some more people signing up. How many do you have signed up already? Do you know?
I don't. In fact, I've got a meeting with my partner who's helping me put on the retreat tomorrow to touch base. So, and we have started. We can have 100 people, and we'll start probably in November with our advertising push. So we're very excited. Once we get our new website launched and we'll start doing social media. I had to hire somebody to get off to it.
It could
So
be a
she's
lot.
gonna help me.
Yeah.
It's a lot. Like, yeah, so she's gonna be amazing and she's gonna help me do all the things.
Awesome. Well, very cool. Well, it was great talking with you today. So yeah, everybody just hop on over there, check out our website, and hopefully I will see you at that retreat.
Yes, I can't wait.
All right.